Welcome to the Cadaveric Demonstration course conducted by Department of Anatomy, Faculty of Medical Sciences, University of Sri Jagadpur. Today we are going to demonstrate a thoracic cross section from T8 level. During this T8 section, first we'll try to orientate this specimen. The first cardinal feature is to identify the anterior aspect by this sternum, and here you can see the posterior aspect, the thoracic vertebra, the transverse processes and the spine of the thoracic vertebra, and here you can see the spinal cord. So this is the posterior aspect of the specimen and this is the anterior aspect of the specimen. So we have the orientation anterior posterior. Now the other cardinal feature is to identify the left and the right is by looking at this descending thoracic aorta. So the descending thoracic aorta, which is on your left side. So this side of the specimen is your left side of the specimen and this is your right side of the specimen. So now we will try to identify the structures in this cross section. So this is your descending thoracic aorta. Anterior to that you will have your esophagus, and here you can see the azygous vein coming up, and here you can see the right side, the posterior thoracic veins which will drain into the azygous venous system. Now when we come to the posterior aspect, here you can see the posterior thoracic wall muscles, the erector spinae muscles, group of erector spinae muscles. Towards the right side and the left side, you can see towards the lower end of the thoracic cavity, you can see the latissimus dorsi muscle. You can't see the part of a scapula now because it's lower down. So here you can see the latissimus dorsi. The big muscle somewhere here is your serratus anterior, covering the thoracic cage. Here you can see the thoracic cage where the ribs are here, and in between the ribs you can see clearly the intercostal muscles. Here you can see the pectoralis major muscle, and beneath that you can see the chondral cartilage attaching to the sternum, and here you can see the attachment of the rib. Now when we come towards the center of the specimen, the heart. So as you know, this side of the specimen is your left side and this is your right side. So you have the left lung and the right lung. So here the cardinal feature to identify the heart structures is by identifying the left ventricle, which is having a huge thickness in the wall. So compared to the right ventricle, the muscle thickness is bigger. So this is your left ventricle. Here you can see the papillary muscle and the chordae tendineae. Here you can see the left atrium, and this is your mitral valve which will open from the left atrium to the left ventricle. So these are the chordae tendineae. So here if you look closer, you can see the opening of the left pulmonary veins, and on this side you can see the right pulmonary veins which are opening into the left atrium. On the right side of the specimen, so this is your right ventricle, this is your right atrium, so this is the intraventricular septum which is thick, and this is your interatrial septum. So this is your right atrium and this is your right ventricle. Now this is the tricuspid valve, so you can see some chordae tendineae also which is attached to the tricuspid valve. Now we will go into detailed description of the right atrium. So here you can see the interatrial septum. So this is the smooth part of your right atrium, and this is the right atrium, the rough part of your right atrium. So in between that, the demarcation line is your crista terminalis. There is a corresponding groove on the outside of your right atrium which you call as the sulcus terminalis. So here you can see the opening of your superior vena cava. So in order to show you all the limbus fossa ovale and the fossa ovalis, I would like to turn the specimen a little bit right side towards the camera. So here in the intraatrial septum, you can clearly see the margin, the limbus fossa ovale, and here the depression here is what you call the fossa ovalis in the intraatrial septum.